In this video, we delve into groundbreaking new innovations designed to enhance bone healing and promote successful orthopedic surgery outcomes. It is essential to ensure that your doctor is aware of and has considered these innovative technologies.
The innovation we delve into is an injectable bone healing biomaterial, known as bone morphogenetic protein, derived from porcine bone. What are biomaterials and bone morphogenetic proteins? Biomaterials are broadly defined as substances compatible with the human body that play a pivotal role in replacing or restoring damaged tissues or organs. Bone morphogenetic proteins, as a class of multifunctional growth factors, are pivotal in initiating, promoting, and sustaining the development and regeneration of bone and cartilage. These proteins are essential components for bone healing. Research has revealed a remarkable genetic similarity of 98% between pigs and humans. The bone undergoes demineralization, a process that renders it more osteoinductive and increases the bioavailability of growth factors. This remarkable substance holds the promise of significantly accelerating bone regeneration processes. It showcases efficacy even in patients with a high orthopedic failure risk, including smokers or individuals grappling with conditions such as osteoporosis, diabetes, autoimmune diseases, and inflammation.
This product, called DBMXTRA, made by Altis Biologics in South Africa, is an easy-to-use demineralized bone matrix, or DBM, for predictable bone regeneration. It comes in a sterile pre-filled syringe in the form of moldable putty. DBMXTRA easily fills the defect and resists irrigation and suction. It can be used to fill a wide variety of bone defects, where it stimulates de novo patient bone growth in a predictable fashion. It contains standardized levels of growth factors in every lot. This groundbreaking bone paste proves invaluable in promoting bone growth in non-union areas of fractured bones and serves as a substitute for autologic bone grafts, eliminating the need for harvesting bone.
A primary culprit behind implant failure is screw loosening. Fortunately, recent advancements in technology have ushered in a new era of orthopedic offerings, with exceptional performance and innovative features.
Amazing results, the best we've ever tested.
The screw facilitates enhanced integration with minimal risk of rejection, immune responses, or adverse reactions. Additionally, the paste is enriched with growth factors to expedite recovery and bone resorption, ensuring that within a few weeks, the patient's own bone supersedes any remnants of the bone paste, leaving no foreign bone material behind.
An injection system that introduces a microparticle collagen carrier with the growth factors so that it can stimulate host bone osteointegration into the titanium implant surface.
This groundbreaking bone paste proves invaluable in promoting bone growth in non-union areas of fractured bones and serves as a substitute for autologic bone grafts, eliminating the need for harvesting bone.
We believe that this technology is first in the world type of technology that involves a cocktail of synergistic bone growth factors, an innovative humanized collagen particle as delivery system, offering the patient the best treatment modality.
The benefits for patients are manifold. 1. Reduced pain and accelerated recovery. 2. Minimized invasiveness in bone graft procedures. 3. Fewer complications. 4. Cost effectiveness. It's noteworthy that the featured products in this video hail from South Africa, a nation with a history of medical innovation exemplified by the world's first heart transplant. Continuously at the forefront of medical advancements, South Africa continues to contribute significantly to the evolution of orthopedic solutions.
Summary. In this video, we delved into an innovative, injectable bone healing biomaterial known as bone morphogenetic protein, derived from porcine bone, with the aim of expediting bone regeneration. Furthermore, BMP demonstrates promising potential as a substitute for autologous bone grafts, eliminating the necessity for bone harvesting procedures. Remarkably, this biomaterial showcases efficacy even in patients with heightened orthopedic failure risks, including smokers or individuals grappling with conditions such as osteoporosis, autoimmune diseases, or inflammation. Overall, patients subjected to this treatment exhibit accelerated recovery rates, reduced discomfort, and more cost-effective surgical process. I trust you enjoyed this video. Please support my channel by leaving some comments. My name is Anna.
Be aware that this video is intended solely for informational purposes. It should not be considered a replacement for professional medical advice, diagnosis, or treatment. Always consult your physician or another qualified health provider for any inquiries related to a medical condition.
Never disregard professional medical advice or delay in seeking it because of something you have read or seen.